I'm Dr. Sadia Virk, CEO and Chairperson of Board of Directors, working at present at South City Hospital, Karachi, Pakistan. Let me introduce myself. I graduated in 1986 from Fatma Jinnah Medical College, Lahore, and then I came to do a residency at Aga Khan University Hospital, Karachi from 1986 till 1989. Towards the end of 1989, and did my residency in gynae and obstetrics, and then I decided to go to UK for further higher education and training. I was very fortunate to have gotten my first job at the Imperial Science College, which really reshaped my career in and around London, basically working at St Mary's Hospital, London, where I worked in high-risk obstetrics, gynae oncology, that's cancer surgery, and then moved on to Basingstoke District Hospital, where I worked in infertility, again in high-risk obstetrics, gynae oncology, as well as training for IVF. I moved around doing various jobs in UK, learning various further experiences, and then decided to come back to Pakistan. When I came back to Pakistan, I got affiliated again with the Aga Khan University, but then I developed private units all over Karachi, at OMI Hospital initially, then at Mideast Hospital, and then I decided to set up hospital for consultants where like-minded people could work and provide a care which would be safe, cost-effective, and evidence-based care. So I gathered a group of doctors in 2005, and we bought an old hospital which was a 10-bedded facility and renovated it, and now mashallah it's a 175-bedded general hospital which provides all subspecialties. So going through this journey, it was a great learning experience for me. I then decided, because there was a transition from open surgery to minimal invasive and laparoscopic surgery, so pursuing with my own professional development and developing a healthcare institution, it was really demanding, but I did my conversion to a laparoscopic surgeon way back in 2006 to 2007, and I had to go to France for that. I had to go to USA, and I really had to work hard and did my transition. And Alhamdulillah, Allah has blessed me with a skill which I have used in Pakistan in treating my patients, especially with pelvic endometriosis and gynae cancers. So most of my work now is laparoscopically done, and I have established an IVF center at the South City Hospital. I have developed state-of-the-art maternity unit with a very well-equipped NICU which takes care of maternal and child health care. My colleagues supported me through every step, and we have developed a general hospital which takes care of general surgery, bariatric surgery, hernia surgery, cardiothoracic surgery, breast cancer surgery, orthopedic surgery, interventional cardiology, neurology, and our subspecialty, which what we are now known for is critical care services, interventional radiology, and our excellence in emergency care in our emergency department. I have gone through various challenges, especially during COVID, which taught us a lot about the new upcoming healthcare with negative pressure installation, air conditioning system, etc., etc. COVID really was a great learning experience which ended up in contributing a lot towards research, development of healthcare, and I was also very fortunate that I was appointed a health minister as well as an education minister and a population planning minister way back in 2018, which really gave me an insight to healthcare at a mega level. So healthcare planning and development has been a passion since then. How can we make it better? How can we excel? And how can we address the main challenges in healthcare now are not the machines, it's not the money, it's the healthcare development, healthcare personnel, because there's a paucity of healthcare personnel, especially the nurses, the paramedics, nurse aides, that group, because all over the world there's no shortage of good doctors. Doctors are being produced according to the population. It's the allied healthcare support. So I have dedicated myself now with a vision to develop and become self-sufficient for our own country, as well as go on a global level where we produce trained healthcare personnel and focus on training, teaching and training along with patient care, and perhaps provide opportunities to our graduates, to our nurses, nurse aides, technicians, pharmacists, physiotherapists to go abroad and seek job opportunities. That will bring legalized way of bringing revenue, foreign currency back to the country. Secondly, it would be all legalized way of immigration and getting job opportunities. Third, it will provide a lot of opportunity to our women to come and invest in this specialty so that they can be self-sufficient and self-empowered. Apart from that, we need to develop more strategies and methodologies for being more cost effective, because it's all about healthcare which is cost effective. It should be value for money healthcare. It should not be a very, very expensive healthcare which is not sustainable in the long run. We are a poor country. We belong to a third world country. So each and every step that we take or each and every move has to be cost effective, sustainable. We need to create sustainable, self-sustainable model. I am really proud to say that we started with a 10-bedded facility without any donations, without any charitable budget. We have expanded to 175 well-equipped hospital. We have expanded on our own means, and the best part has been that we have never neglected our underprivileged population. I would give a small example that our general wards are subsidized by 20%, whereas our VIP rooms are profitable around 30 to 35%. So whatever we earn through our VIP rooms, they subsidize the care for our poor patients. For further expansion, maintaining our budgets, paying our salaries, paying our bills, it is the private room and the semi-private which gives us sustainability, but our VIP rooms generally subsidize our general ward care. So it is a model that is replicable, which can be sustainable, and all we need to focus is developing human resource along with clinical care, because that's the way forward. You cannot sustain any healthcare institution unless you have a limb for teaching and training the healthcare personnel. Apart from that, the take-home message that I would say is that there are three aspects to patient care. The first is the patient. So everything has to revolve around the patient's welfare in the short term, immediate, long term, whatever is sustainable or good for the patient. That's our priority number one. Second is the care provider. We have to look after the interests of the care provider. We need to look after them, their families, their problems. Like a lady with small children, we have to really factor in her constraints, having smaller kids, or having an elderly parent at home. How do you factor in her problems so that she stays focused to the job? So we need to look after our staff, healthcare providers, providing them a simple, decent meal on job. That would make a difference. Looking after their transportation, clean uniform, that would make a difference. Above all, giving them respect, treating them like colleagues. Anybody who's a watchman or a porter or a cleaner is as important in the hospital as the CEO. So the level of respect has to be the same for everybody. Lastly, the third party which is involved is relative. In our culture, it's not the patient. It's the whole family which is unwell. So we really have to factor in and look after the relatives. Due to our cultural norms, the family has to come. For example, in an intensive care unit, if your patient is on a ventilator, the patient is comfortable, cannot feel anything. But the relatives are there 24/7, standing in the corridors, whether they've had a decent cup of tea, whether they have had an access to a clean toilet, or they've got a decent place to sit, where somebody cares cares. Somebody cares about the relative, because relatives are your ambassadors who would say whether you're good or bad. So we really have to create an atmosphere where we are giving a wholesome care. It's the experience that the patient has. It's not just one-time event. You have to give them a sense of belonging to the place. We don't mean that we keep inviting them, or we do wish them well, but whatever we do, it has a long-lasting impact. So we need to be more realistic. With a vision, we need to contribute towards research and development, because the research is the main aspect which gives you an opportunity to improve yourself, to develop newer things. So we really need to be focused on, other than medical education and human research development, we need to be focused on research, and our audits have to be absolutely transparent. The last key to healthcare is the costing. If your cost is right, you are successful. If your cost is not right and you are continuously dependent on funds from somewhere else, I don't think that is a good model or sustainable model. The robust healthcare would be with costing, with patience, with knowledge, with analysis. In 2006, a group of doctors, we gathered to develop a facility which would provide us with an environment where we could practice in collaboration with each other in a comfortable environment for us as well as our patients. So it was a very challenging task, because there was a lot of gap in the healthcare at that time, because a major hospital was demolished and a plaza was being built on that space, or place marked for a hospital. So we acquired this 10-bedded hospital facility, which was very basic, and we had a vision of a general hospital. There was a lot of discussion done in those days that should it be a general hospital or should it just be a maternity and general surgery unit. So the decision eventually was that it has to be a general hospital with a vision for expansion, and we need to look at it from the next 20 years. So it is now 14 years since our inception, and I'll take you through various aspects. That we started with 10 beds. We did not have funds. We gathered whatever money we had from our own savings, begged, borrow, steal, and took a small loan and started developing the structure, building the new building which had to be amalgamated with the old one, and renovating the older block. So we developed a 150-bedded facility, equipped it with for general surgery, planned 9 operating theaters for the surgeons, because it's basically a surgically dominated hospital, and the medical fields initially started just to support the surgeons, but eventually I think now medicine is the main speciality of excellence, where we are providing good quality care. So we put up a new facility. It was completed in 2008, and we started in 2009. More and more people started joining, and each time a good specialist would join, that specialty would evolve. It was a big challenge when we were doing the hospital, providing with constant funds, because initially your occupancy is not good and somebody has to fund or supply for the salaries, for the bills, etc., etc. But Alhamdulillah, we were very fortunate that our personalized care gave us a good name, good reputation, and we developed a facility which is now robust. While building the architecture, we followed the RIBA guidelines, because you have to be careful while building a hospital that what is the temperature difference between the corridors and the operating rooms. The air is not shared between different operating rooms or intensive cares. So basically we had to go through the RIBA manuals ourselves. So in that time frame, while we were building the hospital, it was very labor intensive, going and acquiring these RIBA manuals, going through each and every detail, then connecting with our architects and our air conditioning consultants, etc., etc. We did not have any donations. It was all self-funded, and there was a quest for continuous expansion and improvement. So that led us to our mission of providing safe, which is the most primary aspect of any care, that is it safe for the patient? Are the safety regulations followed? Are the fire exits okay? Fire escapes are okay? The policy for dispensing medication, is that safe? Are the healthcare personnel trained? Who's doing which job? So safety is the main foundation of any hospital. Then second is cost effective. No matter how good or bad you are, that if you're not cost effective, and many people cannot afford it, that's where you fall. Basically, you have to develop a model which is self-sustainable, replicable, which is good for the patient in the sense that you do not ignore the underprivileged section of your society, because most of our patients are from the lower middle class or middle class. So we have to look after their interests, that our care is really cost effective for that particular section of the society. The people who can afford to go abroad for their care, now that the visas are so difficult, and medical care is not a wish list, it's an emergency that you need to seek attention of a doctor in a good hospital. So it has to be at the community level, it has to be accessible, reachable, available all the time. So it has to be cost effective. Lastly, it has to be evidence-based. We do many things in healthcare historically which have proven to have no evidence that was really relevant. So we go according to the evidence-based manuals. There's a lot of research, a lot of documentation, what is really relevant. So our care has to be rationalized, it has to be evidence-based, that this thing helps, this thing does not help. So basically, our mission has to be kept in vision and in front of us all the time while we are improving and reviewing our facilities. Now, over the journey of these 14 years, there has been a view which I'm sorry to say that we are very expensive. There has been a lot of propaganda. A good environment or ambience or a clean room or a clean toilet or having a clean plant in front of you gives the misconception that it's very expensive. You know, expense into a good cause, good care, good result is justified. It has to be cost effective. It is value for money that you get. If you come to a hospital which advertises that I'm very cheap, I'm so many thousands less than the other facility, and you're stuck there for 10 days, you're miserable, you've suffered pain, misery, everything in a cheaper place. Whereas if you go to a cost-effective place where everything works according to a protocol, the quality is taken care, that's one of the main factors, and your hospital stay, if it was supposed to be 3 days, is 3 days, that you're discharged to go home. If it is prolonged, then you're given reasonable explanation that so and so has happened. There's a difference between I don't care or I do care. This is a known complication that has happened. If you've explained it to the patient, then it should not be that it is just expense that matters. It's the overall experience of a person who has met with a complication, how they've been explained about the complication, what has gone wrong that their hospital stay is prolonged. That also matters. And then if somebody's hospital stay is prolonged, you just leave your profits and you just come on to the costs for that patient, because if the poor patient has met up with the complication, the heart has to be in the right place for the healthcare provider, that we are not making any money or profits on that patient. You just come onto the costs, or at times you have to contribute from your own pocket. To be more compassionate, you can't tell the patient to discharge himself or herself if there's a complication and say, there's the door, you go and your money is finished and we don't care. No, it doesn't work like that. You have to be with the patient right from the beginning till the end. So I would like to say that our general wards are fairly subsidized by our VIP patients. Our private rooms cater for all our costs and giving us maybe 5 to 10% profitability, which goes towards our expansion of services, our repair and maintenance, and our continuous improvement and development, developing medical education, expanding the hospital facilities, fulfilling our vision. So we are not taking any donations or charitable budget, because that's good to contribute to the society, but it entails a lot of responsibility, because you're answerable for each and every penny that you take from the donors, and it has to be continuous audit. Unless more people join you who take the responsibility, we are not ready for any donations or any charitable budget. Like any other good law-abiding citizen, South City Hospital has always paid all its taxes. We have not taken any subsidies. So we have created a model which is self-sustainable and replicable. That's our strength. When COVID came, we had a huge learning opportunity in an emergency situation which was thrown upon us. It caught us by a surprise like a tsunami, and we either had to stop doing what we were doing or get our act together and create a facility which could allow us to provide a day-to-day care, as well as look after our COVID patients, as well as look after our healthcare providers. Now, when COVID came, the fashion of online consultation started, which unfortunately or fortunately has got, it's a double-edged sword, that the patient contact is less and less and more trend of online care. But what we did in COVID was created intensive care unit with its own operating room, with its own isolation unit, with negative pressures, with a lot of changing room for the staff to wear the PPEs, and for the disposal of the stuff used in the COVID unit to prevent the spread of infection. So we created the first model which had a lot of recognition overseas. CNN came, they did a film on us. We had a lot of recognition from Harvard University, and they enrolled one of my associates for a master's degree program at our recommendation, and she has done that. She's back with us, alhamdulillah. Then we had contributed to the research data at Oxford, for which we were given a lot of appreciation for our genuineness of our data and our research methodology, etc., which has contributed to further research and development. Research and development is an integral part, and we are with the ongoing research of Megarox and RemapCap, which are ongoing, and we have contributed to this research from Pakistan. So far, we have provided the largest data. Price Registry is another research organization where all the intensive care units in Pakistan are registered. I'd like to share the 2024 data with you. There are 41 hospitals and 80 intensive care units which are registered. There were 1681 ICU beds. Patients were total 80,562, out of which 23,503 patients from 80 ICUs were enrolled alone in 2024. So average was 293 patients per ICU, but our data from South City Hospital alone was 416 patients for the ICU. The average median age was 49 for all the other ICUs. We had an average median age of 68 for South City Hospital patients. So we were actually dealing with more of elderly patients who have more comorbids in our intensive care unit, and our ICU mortality was much lower than the other ICUs. This is for this current year, as well as for the COVID. Average mortality is 23.5% in the ICUs according to the Price Registry, and for the South City alone is 4.8%. So there's a substantial difference in our patient mortality. Our hospital stay, for overall hospital stay, is much lesser. Ours is 3 days, whereas for the other hospitals it's 5 days. So that also contributes towards the costing of the patient. Overall hospital mortality was 24% for all the patients, whereas for the South City it was 4.8%. The bed sores were 0% in our patients. Reintubation was 0%, whereas the other hospitals had a slightly higher rate for bed sores and reintubation. So looking at these figures, it led us to conducting and sharing our knowledge. So we decided to hold workshops free of cost, which in USA they would charge anything between $1,000 to $10,000 for training the ICU personnel. We are conducting all over the country free workshops, which entails, it's a 3-day workshop or 4-day workshop with 14 to 16 lectures, hands-on sessions. We go from hospital to hospital and we do hold these workshops. We also hold these workshops at South City Hospital, taking personnel from various other hospitals, because that is a strength that we have and we would like to share it with all the other hospitals. There are no boundaries of provinces or districts. Anybody keen to send their healthcare personnel, we do volunteer to teach and train them. We do have a residency program recognized by the local college, which has really given us strength to teach and train in the Department of Surgery, Gynae, Anesthesia, Radiology, etc., etc. Regarding our services, learning from COVID, we do have a separate unit which is on a modular fashion. In case COVID or H1N1 or any other infectious disease comes, we can cordon off a section of a hospital which has got a labor and delivery place, which has got an operating room, because a COVID person has come to us in labor, a COVID-infected person. A COVID-infected person could admit at the hospital with appendicitis, so you can't take them to the general operating theatre. So our infectious unit is modular. We can immediately cordon it off. Our entrance is separate. We have got a separate CT scan, which is for infected patients for any infectious episode. We have developed a vaccination center, so we are also contributing towards preventive health. Now coming to the services, we have an inpatient, we have an outpatient, we have a daycare unit, and we are developing more and more services. At present, we have got emergency room, which is one of the best emergency rooms. One of the consultants from UK, Dr. Shuja, came a few years ago, and he was the main asset in developing our emergency room. And our emergency room is well equipped with its own operating room for minor suturing, minor procedures, etc. For immediate resuscitation, there's a chest pain unit. In the emergency room, there's a pediatric side which looks after the peds patients or kids coming with an emergency. There is a general emergency room. There is a dialysis unit in our emergency room. So it's fairly well equipped, and we do not unnecessarily encourage admissions from our emergency room, whereas we do have a full backup for interventional radiology, so the diagnosis is fairly appropriate by the time we admit the patient. Apart from emergency room, we are known for our services in gynae and obstetrics. We have got a state-of-the-art labor and delivery suite which provides international level care for maternity patients, because maternity patients, we have to remember that they are not sick women, they are well women going through a physiological process, so they are very well aware of their environment. The husband has to be with them, or healthcare provider has to be compassionate. There is an epidural service round the clock. There is a pediatrician who's present at the time of each and every delivery in case the baby requires help, and there is a backup of fully equipped and manned neonatal intensive care for women who come into preterm labor or if the baby requires any attention. Apart from that, in gynecology, we do have excellence in gynae laparoscopic surgery. We do most of our work laparoscopically. We do our cancer surgery partly through laparoscopy and some through open surgery, but our staff and consultants are very well trained on open surgery as well as laparoscopic surgery. We do treat a lot of endometriosis. We do have full-fledged service of infertility backed by a state-of-the-art IVF unit, which is available round the year with standardized international guidelines. Apart from that, gynae and obstetrics, we do have general surgery, robust general surgery, which provides facilities for laparoscopic surgery as well as open surgery. In laparoscopic surgery, we do specialize in hernia, appendix, gallbladder, some of the cancer surgeries where we are doing a lot of work. We are fortunate to have the pioneer of laparoscopic surgery in Pakistan with us, who heads the general surgery department, Professor Mumtaz Meher, who started the laparoscopic surgery in Pakistan, who started the bariatric surgery, which is the surgery for overweight people or obese people to lose weight. Now, coming to this subspecialty, I must really say that we always thought that obesity has to be treated only for cosmetic reasons. No, that's not true. The research and evidence shows us that obesity leads to 10 types of cancers in the body. So treating the obesity is preventive health, that if you're likely to spend lakhs of rupees when you cross your 40th or 45th year with obesity, you can prevent that, all that expense by treating your obesity. You prevent diabetes, you prevent raised blood pressure, you can prevent coronary artery disease, you can prevent cancer. So obesity is a disease in itself, and we do, alhamdulillah, have a full-fledged bariatric service where there is a dietitian, there is a psychologist. We do treat it holistically doing bariatric surgery. Apart from bariatric surgery, our surgical department offers full-fledged cancer surgery. We have one of the most distinguished cancer surgeons, Dr. Samiullah, who has specialized in cancer surgery. Unfortunately, in Pakistan, you have a real shortage of good quality cancer surgeons who would treat the cancer holistically, doing extensive resections, do not leave the cancer behind, with a backup of frozen section, with a backup of interventional radiology, etc., etc. Cancer is a subspecialty. Shaukat Khanum, alhamdulillah, left a landmark and taught and trained a lot of people in cancer surgery. Out of those, we have got Dr. Samiullah with us, who heads the cancer surgery unit and provides with good quality cancer surgery. Cardiothoracic is another important surgery. Dr. Shahid Sami, he heads the cardiothoracic surgery department, and he is one of the most distinguished cardiothoracic surgeons, is a busy cardiac surgeon with excellent results. Our cardiac surgery is backed up by our interventional cardiology, which is well equipped. There are excellent consultants, Dr. Sajid Dhakam, who provides us round the year. He and his team provides us with good quality interventional cardiology and with a very good caring coronary care unit. Our operating rooms, which has other specialties as well, like plastic surgery, but we are also known for breast cancer surgery. Professor Shaista Khan, who heads the breast cancer surgery unit, is one of the most well-known breast cancer surgeons in the country. She doesn't require any introduction, but she has also led us to develop an oncology unit, which is headed by Dr. Azmeena Walji or Azmeena Dhakam. Our operating rooms are supported by a state-of-the-art surgical intensive care unit, which provides good quality post-operative care, pain relief, etc., monitoring to all our post-operative patients who have gone through extensive surgery. Apart from that, we are known for our critical care services like intensive care, I've mentioned before, general medicine, preventive medicine, endocrinology, control and care of diabetes, control and care of pulmonology, etc., rheumatology. We have a spinal surgery unit, we have a neurology unit, which are again really good quality and state-of-the-art. Dr. Nadir Ali Sayed is our neurologist, Dr. Muiz Shirani is here. So our real strength is our clinicians, the group of doctors who make it. Our pediatricians have contributed for years and years for providing good quality pediatric services. There are good pediatric surgeons available who are available for various ailments of kids for all ages till the age of 14. Our orthopedic surgery is headed by Professor Muhammad Umar, and our physiotherapy department is also state-of-the-art to support the post-operative orthopedic patients. Our plastic surgery unit is also supported by our cosmetologists who are providing good dermatology services. In our outpatient department, we have outpatient clinics which are supported by radiology, lab and pharmacy. Outpatient dental clinics are also really headed by professors like Professor Naveed Rashid as well as Professor Saqib, who are there for our dental care of the patients. In the outpatient department, we do have an oncology daycare center, which is a recent addition. We do give chemotherapies, etc. in our oncology unit, which is very clean, personalized, taking care of all the patients who have recently been diagnosed with cancer and treated, and they need a follow-up care. We also have a gastroenterology suite next to our outpatient department where patients come in as daycare for endoscopies, upper and lower GI endoscopies. We do have hair salon or beauty salon for the patients who want to go and avail the services, as well as for our staff. And for the visitors who are waiting in the outpatient department can have a quick hair blow dry or perhaps smaller services for especially female patients. Apart from that, we have a vaccination center which has been very active during COVID for COVID vaccination. We are giving seasonally vaccinations for pneumonia, vaccinations for typhoid, vaccination for hepatitis, whatever is the EPI recommendation. It is in collaboration with the government of Sindh that we do provide the vaccination services all around the year. Our physiotherapy department is very well equipped by our trained physiotherapists, and we also have a school of physiotherapy where our students and our interns are also participating in our physiotherapy program, which is fairly robust, very effective, and we are also planning to provide home care physiotherapy services in future. Our vision is to provide drug and alcohol rehab, because whenever you are setting up a healthcare facility, you go according to the prevalence of the disease. I would say that there's a much lesser prevalence of cancer as compared to drug or substance abuse, as compared to the alcohol addiction. So that's a field that has been neglected, and we are working, and we are soon going to open a drug and alcohol rehab unit for our students, for our women, for our men, so that they can be rehabilitated and they go back to the society in a healthier condition. Apart from that, elderly care unit is also not that well developed in this country. So we feel very sensitive towards the need for providing an elderly care unit, where many overseas Pakistanis who are living abroad are concerned about their parents, that they've installed cameras at home, they don't have good healthcare providers. So we do plan to open a unit for elderly care, for well elderly care, where the parents are here and the kids are overseas. We do plan to open that facility. Apart from our clinical services, one of the major ones that I must mention is our Department of Radiology, which is state of the art. You can buy any machine on leasing, or you can buy it, but it's the man behind the machine that matters. Dr. Vase Jalani is one of our top interventional radiologist who has not only excelled, who has revolutionized the radiology care in terms of his quick reporting, in terms of services, what is the experience. The top thing that he has acquired is, for certain cancers, interventional radiology plays an important role. For hemorrhages, interventional radiology has come to our rescue for embolization, etc. And recently we have done certain cases which has been an eye-opener. 3 occasions I can quote where patients came in with massive pulmonary embolism, which has a 99% mortality, and Vase took the initiative and took them to the cath lab and dissolved, morcellated the clot, and the patient was awake in 15 minutes, and patient was up and breathing with a low saturation of 70% back to almost 95% oxygen saturation if a PE is actively treated. So here is a center of excellence of radiology, where I would like other people from the country to come and learn. We have a residency program, as well as people can come for observership and improve their skills. It's not only for our 4 walls that what we do. If we have certain expertise, we would like to share with the others. We have also conducted deep brain stimulation surgery for Parkinsonism and successfully treated the patients, which is a very, very subspecialized surgery for neurosurgery branch. Our lab services are extremely cost effective. Our lab testing is not very expensive, and we provide the results on the same day, and our lab is quality controlled, where every result is checked and rechecked. And we do have a very efficient service of providing the results in a short span of time. The doctors can access the reports, as well as the patients are given the reports in a quick time frame, so that they can have the efficient follow-ups. Now, pharmacy services. Pharmacy services, one thinks that they're not that important, which is the most challenging job, is to acquire the drug from the right source at the right price, is stored at the right temperature regulation, that the efficacy of the drug is not destroyed according to the regulations of the country, that you are not giving substandard medication, you're not giving any medication which is not procured through a reliable source, which is not temperature controlled, because unfortunately in Pakistan a lot of drugs are available through smuggled sources, where you do get the drug which has not been temperature regulated, and the drug tends to lose its efficacy. So we do have a pharmacy which is extremely reliable, which provides good quality drugs at almost MRP levels, and we do manage our procurement and all through very reliable sources. The ambience of the hospital is very close to my heart. Maybe that's a personalized thing, but now patients do appreciate what is good for me. It's a feel-good factor when you enter the hospital. If you see healthy greenery, if you see a water body or a pond, if you see live fish, happily moving around. That also has a soothing feel-good factor. If you get a good, decent cup of coffee or tea with a good biscuit, so food service is equally important. What is the experience? A patient waiting for 2 hours has an access to a good restaurant in the hospital, adds on to the value addition and overall experience of the patient. I mean, I'm very happy to see mums coming for their waiting time. If they have a long wait at the school, they would come and have a cup of tea or coffee, or patients' relatives coming for a meal, or kids going for a meal with the family, or a mother who's had surgery coming down to the restaurant and having a decent meal with her children, meals made to order for the room service or in the restaurant. So these little facilities do add on. Our gardens are looked after by our local gardeners, and I think gardening is one of my personalized passions apart from healthcare. So our gardeners are committed and they look after the garden like our children all around the year. Each plant is documented, and I think I'm the personalized policewoman chasing each and every plant that my plants haven't died or they're well looked after. Our keeping and security services are excellent. Our housekeeping services are as good as any international standard. The disposal of waste units, the provision of clean toilets for the staff as well as for the patients is extremely important for us, because hygiene is one of the basic things, that you get a clean bed sheet, clean bed linen, which is not used from one patient to the others. The patient's clothes, they are properly washed at proper temperatures with proper detergents. It's a very scientific way of looking at provision of healthcare services, that your housekeeping, how they are mopping, how they are using the vacuum cleaner, how much is the noise control in the hospital, what are the domestic cleaners doing, are they treated with respect, and do they take pride in their job or not? That's all very important. The most important aspect of running a hospital is not only getting business. It has to be the overall approach where there are certain things which are in your own hand, and there are certain things for which you are dependent on the others. And there are two aspects. One is that what is your cost? Your cost is in your control, and whereas getting new business is in somebody else's control, partially in your control, that people will come and your patients are your best ambassadors, not advertising through various modalities that may help. But it's the individual's experience which will be your biggest marketing thing, that what is the experience? Would somebody who's had an experience at South City Hospital, would he or she recommend you to the others, or would she like to come back there or not? What is the level of confidence that you have inspired in her? That is it a safe care? Is it an effective care? Was it painful? Did somebody care about you or not? These are the aspects which either will make you or break. Lastly, the most difficult task is of the security services. At times it's very sad to see people bribing the security guards to allow them to go upstairs, or to abuse them, or to shout and yell at them that don't you know who I am. The security personnel are just following the rules. They are just doing their job, and they are really respectable boys who have a very difficult, challenging job, looking at such a huge turnover of patients and managing the law and order and peace in the hospital environment. Luckily, we have not had any accidents, although we have had incidents where our security has picked up the pickpockets or people who come there with not a clean intention. So security is absolutely essential, that there's no theft, there's no burglary. You feel safe in an environment. Unfortunately, in Pakistan, we do have to look after that aspect. So I think each and every person working in the hospital is as important as I am or a consultant is. Like, I would say that my cleaner in the hospital, a housekeeping ward boy, is equally important as the CEO of the hospital, because everybody has to do their job and everybody deserves the same amount of respect. And we need to have respect for the nurses, for our colleagues, for our helping staff, because it's a teamwork at the end of the day. It's not one person delivering good healthcare. It's a teamwork. It's overall experience of the patient that matters. So we have to continue with this teamwork. Lastly, I'd like to add on to our vision, like we are planning to expand our services. We have done our branding. We are giving our franchise all over the country. Whoever wants our franchise, so far we have given 2 franchises, and I'm also working on taking our services abroad. If Cleveland can come to Abu Dhabi and King's College can come to Dubai, we can also go abroad and expand our services and share our good name and our experience and contribute to the international society. Thank you.